All right, let's go ahead and get started. Thanks to everyone for joining us today, and happy Women's History Month. I'm Emily Barson. I am a senior advisor with Public-Private Strategies Institute, and I previously served as Director of Intergovernmental and External Affairs at the Department of Health and Human Services during the Obama administration. Public-Private Strategies Institute, or PPSI, is an independent research and education organization. PPSI engages in educational activities concerning the public and private sector's roles in advancing societal change and explores best practices and trends through research, publications, and educational events like this one. Public-Private Strategies Institute is delighted to be conducting outreach and education for small business owners and advocates on healthcare benefits, challenges and opportunities, and examining the future of benefits, including the evolving link between benefits and employment. First, just a housekeeping note that this event is being recorded. And if you would like to ask our participants a question during the call today, please enter those into the Q&A box on your Zoom screen. I want to thank our co-sponsor organizations for partnering with us on this event, which you can see featured on this slide. We are grateful for our partnership with these esteemed organizations representing small businesses and small business owners across the country. To frame our discussion today, I wanted to briefly share some information from a poll of small business owners that we conducted as part of our partnership with the Robert Wood Johnson Foundation related to small employers and the evolving healthcare landscape. The full report can be found on our website at ppsi.org/healthcare. Our key findings included, unsurprisingly, healthcare cost, choice, and competition continue to be top issues for small employers. In fact, small business leaders polled shared that their top 4 most important healthcare issues are cost related, with rising healthcare costs having a real impact on their businesses and their bottom line. New options in the market are relatively unknown, but should be watched closely. New health reimbursement arrangements like ICHRA and QSERA, which we'll talk a little bit more during today's event, have recently become available, and small business owners are largely unaware of them as potential options. And given the ongoing changes in the market, small employers find it hard to navigate and often turn to trusted advisors for information. And of those polled, 38% of the small business leaders said information about new options from a trusted source would be most helpful. Through events like these and working in partnership with small business organizations that represent business owners across the country, like the co-sponsors of our event today, we are working to highlight opportunities for small business owners that they may not be familiar with, including the extension of enhanced ACA tax credits, which offer a level of affordability and stability for the 2.6 million small business owners and self-employed adults who get coverage in the ACA marketplace. The fix for the so-called family glitch, which affects how the federal government defines affordable coverage for the purpose of eligibility for tax credits. We know many small business owners struggle to support coverage costs for their employees, and many are not able to extend those benefits to family members. So the family glitch fix is especially important and largely unknown for employees at these businesses. The Small Business Health Options Program, or SHOP, in the states that operate SHOP marketplaces, there is often a lack of awareness of this program. So we are working to promote awareness that can help small business owners consider this among their coverage options to see if it makes sense for them and their workforce. And finally, making sure that small business owners are aware of the new HRA products available to self-employed and small businesses. These obviously have their promoters and detractors, and it remains to be seen the impact they will have on the broader market. But our research found that 70% of small business owners were unaware of ICHRAs and QSERAs. But of those who did participate in those plans, they were largely satisfied with them as a coverage option. Having shared all that background, let's get to it. We have a terrific panel with us today to share their experiences and expertise on healthcare benefits. Let me introduce our panelists. First, Marilyn Serafini is the Executive Director for the Health Program at the Bipartisan Policy Center. Kathy Warnick is owner of Warnick Consultants and a former board chair of the National Association of Women Business Owners. Erica Gonzalez is CEO, president, and co-founder of South Texas Allergy and Asthma Medical Professionals, or STAMP, and STAMP Clinical Research. Dr. Gonzalez is also co-chair of Small Business for America's Future and past chair of the San Antonio Hispanic Chamber of Commerce. And Amy Hall is Minority Staff Director of the Subcommittee on Health of the Committee on Ways and Means at the U.S. House of Representatives. As you can see from that mouthful of titles, we have a great mix of experiences from both the small business owner, small business organization, and healthcare policy perspectives. As a reminder, please enter questions for the panel in the Q&A on your Zoom. And let's get started. To begin, I would love to get each of our panelists' opening thoughts on the small group market from your perspective and background. Erica, let's start with you, followed by Marilyn, Kathy, and Amy.
Sure, thank you, Emily. You know, as a small business owner, one of the things that's most important to us is to be able to offer medical insurance to our employees, not only because it's the right thing to do, but also because we want to be able to be competitive with the job market with the larger corporations and retain our talent, right? So we're losing a lot of talent, unfortunately, because we're not able to compete with benefit packages. The Small Business for America's Future just released a survey last week, and in that we saw that 45% of businesses state that because of the rising healthcare costs, they haven't been able to invest as much back into their businesses, which is really stagnating any type of growth for their company. And 41% has actually had to increase prices in their services, which can be very challenging. Locally here in Texas, it's not something that we're immune to. Small businesses make up about 99% of all of Texas businesses, and we employ over 50% of all people in Texas. So, you know, there's no denying the economic power and influence that small businesses have. And so policymakers really need to start helping us, support us, and so that we don't lose out to the bigger corporations, and so that we can continue to thrive.
Great, thanks. So thank you, Emily, and thank you, Erica, for kicking us off. Again, I'm Marilyn Serafini. I'm the Executive Director of the Health Program at the Bipartisan Policy Center. So, you know, I can't bring you that on the ground perspective as a couple of our panelists can. And we focus on where the opportunities are for bipartisanship among policymakers and how we can address policy to improve healthcare access and such. So the one thing I wanted to mention is that from the Washington perspective, you know, much of the attention around healthcare coverage, at least recently, has been around the public programs, Medicare, Medicaid, to a much lesser extent around the employer insurance market, and to an even lesser extent, the small group market. Really, the last time we saw major changes on small group market were in the Affordable Care Act in 2010. So, but despite that, we know we've got some significant challenges. Nearly 60%, I think it's about 58% of non-elderly Americans, so that's folks who are not on Medicare. So about 58% get their benefits through employers. When it comes to smaller firms, only about half are offering a health benefit, and there are really significant challenges around having enough buying power to have leverage to get good deals and good prices. And really, healthcare costs in general are the issue. So, you know, from my perspective, what I think we could be seeing, and maybe where we need to go, is in looking at how to bring down costs generally in the healthcare system to make it easier for small businesses to be providing health insurance to employees in a way also that they can afford it.
Great, thank you. Kathy, go ahead.
Within the NAWBO sphere of influence, it's been a major point of interest for us for years, the affordable health care dilemma, I guess. I know there's some conflict about why do businesses have to be the one to support healthcare as opposed to a single payer system and all that. But I agree with Marilyn. I agree with Erica. It's so cost prohibitive. For years, I had less than 5 employees, so I couldn't even get a group health insurance plan if I wanted one. I had no option. There was nothing for a business of my size. Now I have more than 5 employees, I can get one. It's just so cost prohibitive that if I'm paying for the health insurance, then the wages are lower, or I can't grow, I can't expand our space, that kind of thing. It always creates such a conflict, and you have to decide what's more important. Now with the advent of the QSARAs and the ICRAs, I have something available to me that I can, provide to my employees, and it's amazing. And we provide outsourced accounting for our clients. And, I have 2 clients that are, over $10 million in revenue. The rest are small business owners like myself. And I see the same thing in their businesses and in their financials. They also have to make the decision, where am I going to spend the money? Is it more important to spend it here, or is it more important to spend it there? And when you pull the woman-owned business into it with the less access to capital already, it even makes it harder for us to compete with other businesses.
Thanks. Amy, do you want to share your thoughts?
Sure. The small group market, I think, has gotten a lot less attention of late, just period. And as folks really know, so much of the focus and energy on the individual market. And I guess what I would say is, thus far over the past few years, the small group market has been relatively stable. And Emily, tell me if I start breaking up, like send some sort of a signal, because I'm getting that message again. The market has been relatively stable, and we have seen some small businesses switching to self-funded plans, but not too many. But the underlying question is one of affordability. I think everybody else here has highlighted that very issue. And I think from our perspective, the key is to start thinking through addressing the underlying cost drivers. What we really don't want to see is, employers starting to switch into arrangements that kind of undermine the marketplace and encourage risk selection. And, I think that, those kinds of solutions, whether it's, MIWAs or association health plans or other, potentially discriminatory angles that pull people out of the market, I think we don't want to endorse, but we really do welcome, the option of working with people to, both lower costs and do, make improvements in the market to make it more affordable overall. So
great. Thank you. Marilyn, I know you touched on this in your remarks, but can you provide some more context on the role that employers play in providing healthcare benefits, and your thoughts or your research on the current status of the healthcare market?
Yeah, absolutely. And first, I don't want to forget to mention that we not too long ago put out a report with some policy recommendations on employer-sponsored insurance, not specifically on small business, but it does address small business. And I do subscribe to exactly what Amy is saying, that really, I think our best option for making progress here is to focus on the underlying drivers of cost, since cost, really is the big issue here. So here's what we know. We know employer insurance is popular. People who have it tend to like it. But the cost to both the employer and to the employee, it's long been a problem, and it's only getting worse. And of course, it's worse if you're working for a small business. One of the major drivers is of late has been hospital spending. And we know that consolidation in the healthcare industry has been significant. And there also is a connection in many cases between a lot of these hospitals buying up other hospitals and hospitals buying up physician practices. We know that a lot of that consolidation that's already occurred is there is a correlation there with higher prices. Not always, but in a lot of occasions, we end up with higher prices. And of all of the markets in the US, more than half of them are considered highly concentrated, which means they're there. They're there. There's a lot of consolidation there. One of the other major drivers is drug prices. So these are two areas that are getting some attention right now. But let's just take a half a step back and put this into perspective. We've all talked about costs, so how bad is it? We know that employee premiums and deductibles are rising, and you put that up against real wages, which are fairly stagnant. Between 2009, 2019, so a 10-year period, deductibles grew 162%. Premiums grew 54%. These numbers are much higher than the growth of inflation, which during that same period was 26%, and wage growth 20%. So nearly a third of employees have deductibles right now of at least $2,000. And we know that this is causing some people to skip or to delay care. And we know that some deductibles are even higher. And the last thing I'll say is that we're not seeing employers talking about continuing to go in that direction to increase deductibles or other forms of cost sharing, because they know that they just can't go any further. So I'll stop there and let somebody else fill in.
Thanks. And just to flag, we did get a question on sort of how are you describing small business? And I'm not sure exactly what this means. What percent of this is 10 and contractual employees? Marilyn, I don't know if you defined that in your report or if you want to react to that.
We do define it in our report, but I honestly, I don't have that in front of me. I'm not sure. Maybe somebody else can help fill in. Amy, I'm sure you probably have that in your head as to what the common definition of small business is.
It's not, in some instances, it's under 50, and some it's under 25, I think. It just depends.
And if I can add, according to the SBA, it's 500 or less. So it just depends on what arena you're in, what that number actually is.
Yeah, and obviously the experience of a business owner with, several hundred employees is very different from a mom and pop shop of, 4 or 5 folks, like what you were describing, Kathy. Right. And I think, the question raises a good point about, a lot of people having been shifted to contractual employees or the different types of employer relationships. So that's certainly something that I know a lot of us are tracking as we talk about the future of benefits. Next, we're going to turn to Erica, to Dr. Gonzalez, as someone who isn't just a small business owner, but also a healthcare provider and involved with several small business groups, both nationally and in your community. What do you think policymakers need to know when thinking about healthcare policy and the future of benefits for small employers?
Sure. So, for small employers, it's very important for us to be able to have affordable healthcare to offer employees. Not only in a lot of instances are they like an extended family, but also they're vital to our success as a small business. And if we can't retain the talent, then we're constantly seeing turnover in employees, and that really impacts any small business. It's just a hard thing to have to go through. Not only that, but the high healthcare cost often makes us have to kind of puts us in a position where it's hard for us to know what the next step to do is. I want to see my company grow, but that means I have to hire more employees, which means that I'm going to have to, put more out towards healthcare. It's going to cut the bottom line, and that just makes it difficult. It almost makes it impossible for us to be able to continue to grow as businesses. And again, small businesses are so important just to the overall economic health of the nation that policymakers really need to, pause, consider this, and realize that, there was previous reports that were released by Small Business for America's Future that showed small businesses were the economic engine that took us out of the Great Depression the last time, and were also very pivotal to helping us during this last recession. And so we need them. And if they don't help us thrive, if they don't help us survive, then we're going to be feeling it as a nation, not just small businesses themselves. A healthy workforce is a strong workforce, and so we kind of can't lose sight of the fact and the role that small businesses play in this.
Absolutely. I think that that's a great point, and really leads into my next question to Amy and Marilyn. There does seem to be strong agreement that the employer market is a critical piece of the puzzle when it comes to access and coverage, and with nearly half of American workers employed by small businesses. Where do you think there are opportunities to support small employers, and what's the likelihood for bipartisanship in this area?
Amy, do you want to start, or would you like me to?
Sure.
Okay.
Based on the hearing that we had in the Health Subcommittee last week, it feels like there's very little opportunity for bipartisanship. A lot of what we heard from the folks on the other side of the aisle was that because costs are high, that shows the ACA didn't work. And so what we need to do is reduce the amount of subsidies that we provide people, and provide more incentives for individuals and small businesses to switch out of the current risk pool into off-market products, which again is a concern because of the comprehensiveness of benefits, or what happens to the risk pool overall. So, I don't know what to tell you about the bipartisanship. And I would just say, overall, right? Yes, healthcare costs are going up, and which years you pick to look at kind of what has happened to costs affects, as you guys know, right? If you pick 2010 through 2020, or if you pick 2008 through 2019 or whatever, things look different. But, overall, growth in per capita out-of-pocket expenditures, oddly enough, you wouldn't think, right? It hasn't increased at a particularly high rate after the ACA. Expenditures in 2020 were lower than in 2007, adjusted for inflation. Now, that said, it's still too expensive. So I think, the way we are approaching this is not to say, look at the growth in this, look at the growth in that, right? We don't have to look at the growth. We know people are struggling with what the cost is. And so we need to look at solutions. And so folks talked a little bit about hospital prices. Another big component of healthcare spend, particularly in the employer market, is prescription drugs, right? We have to do more to lower the cost of prescription drugs. We took some steps, largely applying to the Medicare market. We would like to apply the negotiated prices to the private market. It only starts with 10 drugs, but hey, 10 drugs is better than none. So I do think from our perspective, we all know, and our members actually said this in one of our member caucuses, why are the Republicans focusing on, high costs without a solution that addresses high cost? And we really want to focus on that. Sorry, that was a little rambling, but you get my point.
So I'll build on that, and I do agree with much of what Amy is saying. I don't see us doing a lot that is very specific. However, However, there is a lot of attention. I think we should pay attention to where we're seeing attention. And I think some of that attention is coming to a head on prescription drug prices. So there's quite a bit of bipartisan support for, well, there's some bipartisan support for increasing transparency, for example, pharmacy benefit managers. So we're starting to see some hearings on this, and we're starting to see some attention. So this could be one possible area of focus. Also, we're seeing some other things happening, such as look at the insulin cap. There's been some attention to that. So this is just, I'm not pointing this out as, yes, we're going to see action here, but yeah, we're starting to see some bipartisan attention to these issues. Also, we have Medicare drug negotiations that are going to be coming up. And, you know, some of that could spill over into the private market. Okay, another area which I mentioned before is the area of consolidation. And this really is something where there is some interest. And whether we can get anything done here, I'm not sure yet, but we can hit this from two perspectives. And one is making sure that that mergers and acquisitions going forward get greater overview and scrutiny to make sure that they're not going to create situations where prices are going up. But the other way to approach this is from the systems, the health systems that are already operating in areas that are what we call highly concentrated, meaning really overly consolidated. And for those, you know, BPC has put out some recommendations that look at ways just to help to moderate some of the prices that are going above market. And you can do that by comparing it to Medicare prices, or you can do that by comparing it to prices in markets that are not highly concentrated. So that's a possibility. The other area is in giving smaller firms more purchasing leverage. We had in our employer-sponsored insurance report, we had a proposal to have a demonstration project at HHS that to design something like a multi-payer coalition demonstration. Now, this could be combined with developing high performance networks and providing some grant funding to state employee plans or agencies to coordinate coalitions. So these are all some ideas, but I'll put that all in perspective. What's really getting attention now are the high drug prices. Transparency is a possibility, and consolidation. Those are the two things I would really focus on.
Great, thank you. This next question is really, I think, starting with Kathy, but welcome others to weigh in. This webinar is falling during Women's History Month, and just really looking at the experience of women business owners. As we've talked about, our research touched on cost as the primary barrier to increasing employer-sponsored coverage among small businesses. And Kathy, with your experience both as an employer and as the past leader of NAWBO, what challenges or opportunities are unique to women business owners?
So I don't think the cost of insurance is unique to just women business owners per se. Yes, it's known that women have less access to capital to grow and all that than their male counterparts in business. But one thing to think about here is, from a women business owner's perspective, is it's also a known fact that females' health insurance costs are way higher than their male counterparts. And so for the women business owners, if they're on their own health insurance, it immediately is higher. And they often hire a lot of women. And so that raises the cost as well, especially when women are within childbearing age. And it's been my experience that childbearing age is a little bit higher than what women actually do bear children in. So I'm not sure about that exactly. But I don't think that it's unique to women business owners. I mean, the less access to capital is part of it, but it's an issue across the board for all small businesses, whether they're women-owned or male-owned, I think.
Sure. Any other perspectives on, sort of what women business owners are facing?
I can give an example for one of my clients. It
Great.
is not a women-owned business, but the majority of his employees are women. And his health insurance cost in 2023 went up 40%. 40%. And he called the insurance company and said, what? Why? What happened here? He had one employee who hit a new age bracket, and that caused his insurance to go up 40%. Like, small business owners they just can't sustain that kind of cost on an ongoing basis.
Yeah. No, and certainly they don't have the economies of scale of large businesses where one employee having a change in circumstance might, shift the needle slightly, but when it's, 1 out of 5 or 10, it's a much bigger piece of the pie.
But I do want to highlight why that example actually is a really good example of why we need to keep the risk pool together, right? Why we don't want to fragment the risk pool and send, allow people to go off onto their own, because what happens when, you're an employer, you've done that, and all of a sudden you're off in your own little thing and your premium goes through even worse through the roof, right? The whole notion here is spreading risk. And the more people go off into areas where you're able to, discriminate, whether it's more, age or gender or, pre-existing condition or benefit discriminations, then when that event happens to the employer, they're really out of luck. What, are you going to fire your worker? Or is it going to change the way you hire? Does this mean that people will be less willing to hire women because they know if I hire women of childbearing age, they are going to raise my premiums in this more so in this off market situation? So I would just say, this is why we really need to keep all of the risk together to spread the risk more evenly across the whole population. The other point, I'm sort of going afield here, but I think the other point I would make about whether it's, consolidation, if you kind of look at, if you look at, it's not just, whether it's hospital consolidation, but we also have to look at, the insurance companies all own the PBMs, right? And we've got, United, I think, is the largest employer of physicians in the country at this point, based on, between United and Optum. So we really need to be looking across at all these issues. They're all interrelated across the spectrum. And the third or fourth or fifth, I don't know what number I'm on now, piece that I think is important is to also look at what is happening with private equity ownership of a lot of these medical, whether it's medical specialties or primary care. There's a great study that maybe was in, I can't remember, it's Health Affairs or JAMA, which talks about, private equity ownership after private equity acquires some of these physician offices, the utilization of services and price goes through the roof. And so that too is affecting the prices, right? So we can't just say we're going to go after the hospitals, because not all hospitals are similarly situated and some are actually really struggling, and we want to, keep those guys afloat. And we can't just go after the insurers, and we can't just go after, we kind of have to look at all of these solutions. We can't do the PBMs. Going after the PBMs isn't going to solve the whole problem either, right? We got to kind of look at everything together. And I think it's a tall order for Congress. There's only so many staff, but, we welcome folks' thoughts and ideas on kind of the right pressure points here to work on.
That's what Amy's saying is really super fair. And I'll just bring in one more point. You reminded me when you're talking about hospitals that rural hospitals are really super struggling right now. And of course, everything's harder in rural. But, when I talk about consolidation, I'm really not talking about rural areas. In some cases, consolidation is very necessary in order to be able to get services to people in those areas where there are limited providers.
And some of the rural closures we've seen have been related to private equity purchase of these facilities. And some of the rural closures and struggles of these hospitals have been related to the fact that the states, they're really doing poorly in states that haven't expanded Medicaid. And Medicaid is such an important pillar for people in rural communities. And, when hospitals don't have paying customers, well, they have trouble.
Mm-hmm.
So that brings up a question I have, Amy, if I can have a minute, Emily. So I'm in Columbus, Ohio. Okay, we have 3 major hospital chains here in this small Midwestern city. It's a well-known fact that if one of the hospitals builds a new facility within a 5-mile radius, the other 2 are building it as well. And then, of course, they don't have enough patients. It appears to the lay person, right? They don't have enough patients. And then the costs go up because they're building these facilities that aren't, I don't know, are they profitable? How can you have that many large hospital facilities in that short of a radius?
So, and I don't know what the answer to this is, right? And I'll play devil's advocate, and I'm not right. The other side would say, okay, well, but if you have certificate of need, you're going to crush competition, and the competition is what's going to lower prices. Well, we know that doesn't work because the healthcare market doesn't work like a normal economic market, right? It's kind of all a mess. So, in some states, they have done a better job of, kind of regulating oversupply, because oversupply induces, look no further than the hospice industry, right? Oversupply induces demand in lots of areas. So I don't know what the right solution is there. And some of the pricing issues are probably related to the provider's leverage vis-a-vis the insurers.
Right.
And so this is why my refrain is there's really not one thing we're going to be able to do to effectuate change that's really going to solve the problem. And one of my concerns is if you have this whole entity, healthcare microcosm, and you just push here, well, what's going to happen everywhere else? And so maybe we really need to be looking at more solutions at once rather than just saying we're going to go after hospitals or we're going to go after PBMs, because if you push on one piece, it's going to distort everything else in ways that maybe we can't envision. I think I'm pretty smart, but I'm pretty sure I can't see all of the possible outcomes from, across the nation, particularly with how localized some of our healthcare markets are, right? Anybody who spends any time out in Pittsburgh knows they have some things going on over there, between their plans and their providers, and they look very different than New York City, for example, or very different than, rural Texas. And so, how do we know that the button we push might work in one place, but doesn't work in another place? So we need to really be looking at multiple solutions at the same time.
Yeah, even just among rural areas, the saying goes, if you've seen one rural area, you've seen one rural area. And this is, there's a Department of Health and Human Services is implementing a new designation for some rural hospitals called the Rural Emergency Hospital Designation. And this actually speaks to, not one solution for every community. But this would allow some hospitals that really aren't needing to be a fully rounded hospital to change into mostly emergency and outpatient departments. But one of the things we haven't talked about, which is really a problem right now and is bubbling up, is workforce. And the workforce situation got a lot worse during the pandemic. nursing got a lot of attention, and now some of that has leveled off to a certain extent. There's still longer term problems, but the real issue right now, what has not bounced back, is the direct care workforce. So those who are taking care of people in nursing homes and rehab facilities, and also with post-hospital care, post-acute care in the home. And that's really reverberating throughout much of the healthcare system. Hospitals are getting backed up to the point where some of them are having trouble many of them are having trouble discharging patients, and some of them are also even considering delaying procedures, elective procedures for patients, because they don't have the capacity inpatient. So this is the kind of thing, I mention this because it really is going to resonate throughout the system. Hospitals are paying more for nurses than they did before the pandemic. Payment to these direct care workers is still low, but it's going to really need to get higher if we're going to get more of those people back into the system. And so here is yet going to be another cost driver that could be seen in insurance.
Yeah, no, it's a great point, and I think underscores Amy's comment about pressures on different pieces of the system, and the impacts that they can have that that really reverberate, because that's a cost issue and an access issue where we see some of the services being curtailed in particular areas. Amy, I think you mentioned this, but we just marked the 13th anniversary of the ACA last week. And what do you think small business owners need to know about the opportunities available for coverage? And one of our questioners asked, does each state have a group buying option for small businesses to come together and buy as a bigger number? And maybe you can touch on what opportunities there are related to that as well.
So you would think I would know the answer to these questions, but I don't actually. I mean, not every state, only a few states have shop marketplaces for small employers as a result of the ACA. DC, I think, has a pretty robust one, but not all the states have done that. And so then I think the question becomes, what is the right way to deal with small group and also sole proprietors in terms of, if your employer doesn't offer coverage, people can always go into the exchange and get subsidized coverage. Lots of employers like to offer coverage, as we heard earlier, right? It helps attract and retain workers. And so,
Amy froze. Oh,
yeah,
you're back.
I told you I'm having troubles. I'm going to go off camera. Okay.
Yeah.
So some states, have tried to combine their markets, their risk pools across the market in order to make it easier for employers to sort of figure out where to get and how to get coverage. Those are the kinds of issues that we're thinking through, like how do we support and encourage, more states, and, some of the employer small business tax credits, they're time limited, they're income limited, they phase out based on the number of workers you have, right? And so we can look at those things and try to provide more support for small businesses that want to offer coverage. And we are actually we are looking at those things. But unfortunately,
we lost
kind of
you.
very uneven across the United States. And it does.
I think we lost Amy as she was saying that the opportunities are uneven state to state, perhaps.
Yes, that's what I was saying. Am I back?
Yeah.
Sorry about that. Yeah. And so we're thinking through, what are some things we can do to address that in a way that supports all small businesses and doesn't just help some at the expense of others.
Yep. Kathy, you mentioned this in your remarks earlier, but as folks are aware, several new options for health coverage have come onto the market in recent years. And I wonder if you could just touch on your experience using a health reimbursement arrangement and how you made the decision about which coverage offerings were going to be the right fit for your business and your employees.
Yeah, sure. So I'm a big proponent of partnering with experts in certain fields. Like, I know nothing about health insurance except it's expensive. So I partner with a human resources consultant. So she helped me sort through all of the options that were available to me. I realized somewhere around the middle of the pandemic, when that great resignation was happening, fortunately for me, business didn't go down. It actually picked up because all the people who were leaving, those businesses still needed their accounting done. And so often that's when they start outsourcing. So I am desperate to hire people. I cannot find quality candidates that want to stay, that are within the salary range that I need. And so I had to improve my benefits package, right? And not just salaries, but everything that goes along with it as well. So I talked to my HR consultant about what are my options. I'm not sure at that point that the ICHRA was available. I think the QSARA was the one that came out first. I could be wrong about that. Don't quote me. I have a lot of clients who use the HSAs and the standard HRA and all that, and I see the struggles that they have just managing that. I don't know that the plan itself is bad, just managing it, all the paperwork and everything that needs to happen. So I went with the QSARA. And the QSARA, for those who don't know, allows me to reimburse insurance premiums up to a certain point. I think it's $467 or something a pay, $3,600 maybe a year, pre-tax. So the employee gets it pre-tax, and all it does is reimburse for insurance premiums. The employee has to provide documentation that they're actually paying the premium out of pocket. I now am aware of the ICHRA, and I'm actually getting ready to look into maybe changing from the QSARA to the ICHRA, because it gives me more options in designing the plan. The QSARA is a pretty rigid plan design, and the ICHRA has some more options available there. And so I'm going to start looking into what the ICHRA can provide over what the QSARA can provide. The other issue for me is we currently, not by design, but currently have only women working here. It is an all-female firm at the moment. The majority of my employees are on their husband's health insurance plan, right? So for me to now go to a health insurance plan that I can afford within my organization, then their coverage is going to be way different and less, very much less than what they're currently getting with their husband's health insurance plan. So even now that I have enough employees, I could actually be on a traditional health insurance plan. It's not the right move for my employees. So I'm really grateful for the QSARA and the ICHRA, and what did you call them? Health reimbursement.
Yep, health reimbursement arrangements.
Yes. So I like it a lot, and I've been counseling my clients as well to check with their HR partners and see what they can do to reduce some of that cost that they have for the traditional health insurance plan.
Yeah, and Kathy, you're not the only one who's looking at taking a closer look at ICHRAs. Kaiser Family Foundation recently came out with a survey. They survey employers periodically, and they found that 9% of smaller firms, and here they identified it as between 50 and 99 employees, that 9% of them were, quote, very likely to offer ICHRAs to employees in the next couple of years. I mean, 9% isn't huge, but it's growth, and it's something that more folks seem to be looking at.
Right. The only drawback that I have seen thus far, and my team actually appreciates it. I mean, it's made a difference, right? I don't have to say anymore, I don't have a health insurance plan. Now I can say we have a health insurance reimbursement arrangement, and they like that. But the one issue for me, and I guess I'd rather this issue than the high cost of a traditional insurance plan, is that there's some reporting processes that have to happen throughout the year. I'm fortunate enough that my HR consultant takes care of that for me, and I don't have to, I don't worry about it. I worry about that it gets done, but I don't have to do it myself, right? Those are hours, costs and hours for me, not, laying out money for this traditional health insurance plan. And that is actually an ongoing concern for me when I look at all the research and stuff that's happening, is this need for more and more reporting from employers who provide, these health insurance plans. And it's just not, it's hard for small businesses. We don't have somebody in that department who can do that. It has to be me or somebody's director of operations, right? And then we don't have time for that. So that happens after hours, right? That kind of stuff really has an impact on the small businesses.
Yeah, and someone just asked, in the Q&A to educate about ICHRA, and I know we're coming up on time, but it really briefly. So there are two new types of health reimbursement arrangements that have been created in recent years. ICHRA is the individual coverage health reimbursement arrangement, and the QSARA, which is a bit of a mouthful, is the qualified self-employer health reimbursement arrangement. And they're similar, as Kathy noted. There are a few differing rules governing those, but each of those allows employers to offer employees a monthly allowance for healthcare costs. Employees can then choose and pay for individual coverage and other qualified medical expenses, like their insurance premiums and other expenses. And then the employers reimburse employees up to that set allowance. And we do have some more information, and certainly some of the research that we conducted, which I think similar to what Marilyn cited from Kaiser Family Foundation, is in the report at our website, ppsi.org/healthcare. Someone also asked, will the recording be circulated? And indeed it will. So just want to make sure folks know that this will be also available at that same website, ppsi.org/healthcare. So we are coming up to our time, and just really want to give everyone another chance to sort of reflect on this conversation. And, as we've talked about, much of the conversation around private healthcare is much the attention is paid to the large employer market. But where do you each, sort of what's your perspective on the future of benefits for small employers as it relates to healthcare, and reflecting on this conversation? Maybe we'll go in the reverse order. So we'll start with Amy, Kathy, Marilyn, and Erica.
I was helpfully trying to respond to one of the questions in the chat. So tell me what you want me to tell
Okay.
you again.
No,
I'm
just,
sorry.
sort of reflecting on this conversation, much of the attention in the conversations about private sector healthcare is on the large group market. But, where do you see the future benefits, sort of headed for small employers?
Yep. So, I mean, I would just reiterate what I said earlier, that, the small business market has kind of been under folks' radar for a long time. And this is something that we are now starting to look at and think through, in terms of solutions. And honestly, like, we are interested in folks' ideas, interested in folks' solutions. I had a decent conversation with one of the Republicans witnesses before our hearing last week, where, I said, look, some of these things we're definitely not going to be on board with, but some of your other ideas, we're going to chase them down and run the traps on them, because we do want to help small businesses that want to offer coverage, make it more affordable, and also make it more affordable for the consumer. And, I just, one thing I will say to the couple questions in the chat on PBMs. as with the other kind of cost driver issues, it's something that we are trying to think through, like what, and again, send us your ideas, like what is the right answer, because some of the initial options that have been put out, whether it's just requiring the pass through of the discount direct to the consumer, wind up raising consumer costs. And so that's not really where we want to be. And we're trying to figure out, like, yes, okay, transparency, good. So we can do some of that, but like, what more should we do? But we want to do it in a way that actually doesn't, create the wrong outcome. So again, please hit us up with your ideas.
Yeah. I don't even know what to say.
Maybe you've said it all, and that's all right also.
I mean, one thing I have said for years and years, as I'm in DC advocating for women business owners and small businesses, is there needs to be a defined number for small businesses, right? We have, I don't know, is it micro business? Is it, I don't know. There has to be a number. It can't be anywhere from 20 to 500. There has to be a defined number for small business. And I think that would help in making some of these decisions on how it's going to impact different small businesses when these changes happen. I mean, somebody who has 500 employees can handle an increase way better than someone who has 5 employees. So to just say, under 20 or under 50 or under 500, it isn't fair to the small businesses in this country, who are, by the way, the backbone of this country. You have the Fortune 500 and the Fortune 1000, but the majority of businesses owned in this country are by small businesses. They are small businesses, not those large businesses.
Great, thanks. Marilyn?
Yeah, I'm going to be really quick, and I just want to circle back to those things that aren't specifically, they don't have small business in the name, but let's just keep looking at the cost drivers. I think that's going to be important for everybody, but probably no one as much as the small business owners and the employees that work there.
Great, thanks. Erica?
So I agree with everything that's been said, in particular cost drivers. I think that we really need to start focusing on that. I think part of what is hopeful is that, one, people are recognizing what those cost drivers are, right? We're really, now trying to see, okay, how can we hold all these different areas accountable, but also that the small business owner is now recognizing it too. And specifically for me, being in healthcare, the biggest driver, I think, and this all started, with a spotlight being put more on pharmaceuticals. And that actually happened because of the patients, because when premiums started going up, when copay started going up, a lot of that cost was transferred over to the patients. And then, it was obviously affecting healthcare access for so many that they, went to lobby and fight with their policymakers to say, hey, something needs to be done. So I think that the fact that there's more awareness is going to play a big role in how this plays out.
Great. I think we are right at the top of the hour. I want to thank all of our panelists today. I thought this was a terrific discussion. We tried to get to as many of the questions as we could. I think we might have missed a few at the end, but we will be continuing to hold opportunities like this, both virtually and in person at some of our partners' conferences. So really welcome the opportunity to engage with you and to hear from folks about what they're experiencing. So we will send around the recording and look forward to having another chance to connect. Thanks so much. Have a great afternoon.